Hello, everyone, and welcome. We are excited that so many of you could join us today for our conversation on centering connection and creativity for health and well-being. I'm Pele Shaleb, the Events and Engagement Manager for the Office of Events at the California Institute of Integral Studies, a nonprofit university in San Francisco. We may be joining from different places all over the world, and as a representative of CIIS, I want to start off by expressing our debt and gratitude to the Ramaytush Ohlone, the original peoples and continual caretakers of the San Francisco Peninsula. CIIS campus is located on the traditional unceded lands of the Ramaytush Ohlone, which they call Yalamu. In the Ramaytush Ohlone language, Yalamu identifies both the people and the territory. This acknowledgement is only a single, small step towards being in deeper connection and relationship with Indigenous tribes and organizations in our community, and does not begin to acknowledge all the native lands, languages, and territories where you are right now, or where you live and work every day. I invite you to take a moment now to acknowledge the land where you reside, and to commit to learn more about the native communities near you and to support their work. If it feels right for you to share in the chat, please do. We always recommend native-land.ca as a starting resource. Before we start, I want to go over a few general tips and troubleshooting items. We will have a Q&A after the conversation tonight. Please submit your questions at any time using our anonymous web form, which is linked in the event description below this video. We'll be pulling questions from that form, and we'll try to get to as many as we can. We do have automatically generated captions for this event, which you can toggle on and off using the closed captioning button in YouTube. Chat will be enabled during this event, but please note that it is not being moderated, and our presenters cannot see the chat. Chat is not required to fully experience the event. If you choose to participate in chat, please be respectful and avoid language that could be offensive or insensitive to others. You can turn the chat off at any time, and we encourage you to do so if you find it negatively impacting your experience in any way. If you're having issues with your audio or video, we always suggest that you start by refreshing the page, and then if you're still having issues, we suggest that you adjust your video settings within YouTube. I'd like to extend a special thanks to the members of Public Programs. Public Programs membership has never been more valuable, providing a year's worth of conversations for free and every workshop for 20% off. You can find more info on our website or email us at publicprograms@ciis.edu. Now, let me first introduce our presenters, Dr. Christine Brooks and Dr. Liz Markle, and then we'll get right to the conversation. Dr. Christine Brooks is a professor and the chair of the Masters in Expressive Arts Coaching and Community Building at CIIS. Dr. Brooks brings over 2 decades of experience spanning higher education, the creative industries, coaching, and even an early AI startup. Her scholarship and practice sit at the intersection of arts-based, feminist, queer, and transpersonal frameworks, and she maintains an active coaching practice working with individuals and groups through arts-based and relational approaches. A committed arts activist, she is also dedicated to ongoing support of local performance artists through creative collaboration and advocacy. Dr. Elizabeth Markle is a licensed psychologist, speaker, writer, researcher, and professor of community mental health at CIIS. She is the co-founder and executive director of Open Source Wellness, a national nonprofit offering experiential behavioral health and wellness via a community as medicine approach in collaboration with healthcare providers, payers, and community-based organizations. And now, it is my absolute pleasure to turn it over to Dr. Christine Brooks and Dr. Liz Markle.
Hi, Christine. Wonderful to be with you this evening.
You too, Liz. Thank you so much. It's great to see you as well.
You know, we started at CIIS as faculty members right around the same time, almost 10 years ago or a little over, and have continued our journeys as faculty members and as innovators and scholars and practitioners in sort of parallel tracks. And I've been so excited for this conversation to give us the opportunity to both compare and share where there's alignment in the work we're doing.
Absolutely. I know. And being faculty and doing our work out in the world, we often don't have a time to just chat. So I'm excited that we get to do this and that we get to share this work with other people because I don't know about, I think this about you. I make these assumptions that you're really excited about the work that you do
Mm,
and that it's
mm.
about really sharing it. You know, we both sort of community as medicine as the core of what you do and the relational approaches that I take. It's about putting this out in the world. And so it's so wonderful that we get to do that together today.
Yeah, for both of these approaches, it feels like the world is ready for and excited for this kind of work. It feels like for me,
Absolutely.
for 10 years, it felt like I was sort of shouting into the wind about human connection and community and belonging. And these things make a difference for human health and well-being. And suddenly we have loneliness reports and belonging initiatives and Surgeon General's attention on this work. And
Right?
especially with the rise of social prescribing, I'm so excited to just dive in.
Yes, let's do it.
Okay.
Where should
Well,
we start?
yeah, I wonder if you can just tell me sort of how did your journey lead you to the world of arts and health and social prescribing? And maybe just tell me a little bit about your understanding of this whole social prescribing phenomenon.
Sure, sure. So my background in the arts is in theater.
Mm,
I was on the stage the first time at 2, so that was my whole early life. And I went to Performing Arts University. I spent all of my time on the stage. It was really my central focus. And that was really also combined with literary arts. And so there's this way in which the arts are just part and parcel of my own being. I don't
mm,
know how to do life without it being focused almost completely on creativity as a meaning making piece of my world. And so the arts were always coming with me.
mm,
And then I had this moment, this big pivot in the very early 2000s after that AI startup that was mentioned, that was way back in the day, um, where I ended up going back to graduate school and doing my work in clinical psychology. And I was fortunate enough to be in a place where expressive arts were a way that we focused and we could specialize in the work that we were doing in my graduate program. And so that was really the beginning of my own journey and my own education around arts as healing modalities.
mm,
And one of the things that I've carried forward throughout my life is that art heals. That's sort of a fundamental premise that I believe in, and that the world, like you said, is really catching up to. And I'm saying that I want to rephrase that because I think this is an important distinction. In my opinion, I think that humanity, peoples all over the world have always known the healing factors of art, have
mm,
always known that art heals. I think that traditions throughout the globe and peoples throughout the globe use the arts as part of their community building, use the arts as a way to communicate with one another, to share, to enact rites of passages, to be in the world and express what it is to be human and to have this journey. And so when I say that things are catching up, I guess what I mean by that is the scientific and medical communities
mhm,
or psychology as a field or the way that we think about, we're so used to being siloed that now all of a sudden there's this, oh, the arts and community are important in the way that we frame well-being like it's news. But it is
yeah.
news because it's important that the research has caught up with what we know to
Mm,
be, because it offers a framing of legitimacy that's really, really important when it comes to things like medical insurance and access to
mhm,
care and the way that we think about health and well-being within the larger scope of not just symptomology and treating symptoms, but really thinking about wellness as the starting point, and that is something that we really want to maintain. And
mm,
in the arts and health paradigm, this is a way in which we're saying the arts belong in healthcare settings, the arts belong as healing modalities. And there's an entire field of study, a field of research, a field of advocacy, and national organizations and international organizations that are saying we must advocate to integrate the arts into medical care and into well-being practices in how we approach people in their home communities. And so the arts and health movement has some really key figures in major universities, as well as the National Organization for Arts and Health, and are saying we have to focus on the healing factors of the arts through research and also through practice. And so I'm very much an active participant in that movement, and it's a foundation of what we're doing in the Expressive Arts Coaching and Community Building program, is we're really using those principles as part of our foundation and part of our pedagogy. And then you mentioned social prescribing, which I know you're going to talk about with the organization that you have founded and that you're running as well. And social prescribing is this amazing movement that's saying that there are factors in our life that we know that promote wellness. And in the sort of overarching social prescribing sort of paradigm, they note that nature, art, movement, service, and belonging are core factors that we can say these are pathways to well-being and should not be ignored. While we are treating people for medical conditions, while we are making sure that people's medical care is appropriate and is holistic in scope, we also can advocate to be including some of these core wellness components in prescribing through a doctor, through a hospital, through a community health services organization. And so social prescribing is a movement that says, whether we are a public medical system like in the UK or other countries, or we're a private medical system like here in the United States, we can be prescribing ways for people to be well. And I find that really exciting because it adds this whole layer to this idea that we don't have to wait for the sickness to occur. We can really approach this from a perspective of saying, what if we focus on being well? What might that look like? And how can we promote that? Not as preventative care, but as just basic fundamental health care.
Oh my goodness, you said so much in there.
That was my soapbox right there.
I love it. I mean, I started writing things down. Art heals, right? Amen.
Art heals.
That is simple. And you know what I'm really appreciating, Christine, is the humility in saying, like, hey, we didn't invent this. It's not like we suddenly had a revelation that art heals and we need to bake it into the fabric of society. We have known this. Communities, societies all over the globe have known this. And that used to be more woven into the fabric of daily life, in ritual, in culture, that art was baked in and community was baked in. And from my perspective, we've lost some of those structures, right? As society has evolved and technology has created some really fascinating shifts and some really positive shifts, we've also lost some of that baked in the groundwater of daily life, nature of those practices for well-being. And so our task now is not to reinvent something, but actually to find new channels or new avenues for these to be accessible to people, not by wealth and not by willpower, but because they're occurring in daily life. And social prescribing, it seems like, is one of those channels, one of those ways to get our systems aligned with what we know actually helps human beings be well. Am I tracking what you're seeing here?
Absolutely. I couldn't agree more. And I love what you're saying about how this is an opportunity to almost regather in new ways and recognize. And when I'm in conversation with medical professionals, which, I don't have as much opportunity as I would like, but in some of the advocacy work that I'm doing these days, I think sometimes we also have forgotten, or that we've lost touch with the fact that our medical professionals are incredibly creative and are incredibly curious in their own right, and that this social prescribing movement and the arts and health movement are an invitation also to medical professionals to reclaim their own creativity and to reclaim the legitimacy of these health and well-being practices and normalizing them for their patients, for the people, that are in their care. I know doctors who went undergrad to art school. I know nurses who have incredible textile art practices in their lives. I know dancers who become physical therapists, and so there's this way in which that split between medicine and arts and other practices of well-being is that divide is so artificial. And so when we remember the wholeness of both the practitioners and the people under the care, we can say, what if we just all shared about our own creative impulses? What if we all just shared about how we connect in the world and what's important to us and took those extra 5 minutes with each other to really learn that and maybe get off the 12-minute patient clock that so much of our healthcare has been modeled on, because the well-being can be happening in the room too, in those, practitioner offices.
Yeah. I'm imagining listeners out there going, gosh, I wish my doctor or my
I know.
therapist had prescribed me this when I needed it or would prescribe me this now. And so I have to ask, for those of us who maybe don't have care providers who are on the bleeding edge of this innovation, if we
Mm-hmm.
wanted to create this for ourselves in some way, what would you
Yes.
recommend? And we can go deeper into this later, but what's your first take at it?
Yeah. I mean, my first take is to start small. I
Mm,
think we also live in a time where we have a lot of all or nothing impulses. I think we live in a time where the word optimization is something that we think we're always supposed to be doing. I'm sort of an optimization denier these days, I won't lie. Because I think when we get into that all or nothing, we can get stuck feeling defeated before we've even gotten started.
mm,
And so if we don't have the access to this with our providers, asking ourselves, and we're going to do a little bit of this later, which I'm really excited about, like really,
yeah.
what does this look like? But my first take is start small and say, where does my attention go? Because
Mm,
what we also know in behavioral health is where we focus our attention, our behavior tends to follow.
mm,
And so out of those five categories, and I know you're going to offer another model in just a minute, but out of those five categories, like, does your heart lead toward nature? Do you feel
mm,
like there's purpose missing from your life? And how might service be useful to you in that? Like maybe some volunteering work would really help you recognize, oh my gosh, people really need what I have to offer in the world. If you're having a lack of sense of belonging, if you're part of this phenomenon that we're calling the loneliness epidemic, what are some small steps to create small moments of connection? Not, I have to find a new set of friends right at the very
mhm,
beginning, but maybe you're going to a coffee shop and like there's your favorite barista that you say hello to every single day. That's a form of connection. There's actually
mm,
science behind how important that is in our lives. When it comes to the arts, like think of this as everyday creativity as opposed to art with a capital A. How might you have your own private dance party to one song in the morning just to like feel into your body and hear the music and have that moment? Maybe you're a doodler. Remember that you're doodling during that meeting might be valuable to you. It might be a way for you to release some energy and to really connect with yourself. And if nature's calling to you, go outside, take your shoes off for 2 minutes, put your feet
mm,
on the ground, breathe in the air, notice the leaves, notice the sunshine. We could all use a good dose of vitamin D here and
mm,
there. So it's
mm.
for me, it's about starting small and developing some micro habits before trying to like become, proficient in every single part of this right from the start.
Yeah.
When I'm working with my clients and I say start small, they often look a little bit crestfallen, like, but I want to change now. And I say, this is the start of the change,
Mm.
tiny increments.
Yeah, what I'm loving about that is that it's helping us not make arts or wellness practices become another should, like
Right.
another thing that we say I should do, and why am I not doing it? And other people are doing it. See, look on Facebook what they're doing. I should be doing it. What's wrong with me? And these things can
Absolutely.
so quickly compound. We hear that in healthcare all the time. Like my doctor said I should do this and do that. And people have a hard time making those changes in their lives. So I love this approach
Yeah.
of not what should you do, but what calls to me, right?
Hmm.
What can I sense would be generative for me?
Absolutely. Yes. And that where my attention focuses, my
Mm,
behavior follows. Like that was taught to me by my mentor, David Daniels, years and years ago. And I just see it time and again that if we
mm,
start with what calls to me and just start there, as opposed to there being some exact right prescription, that it sticks in a
mm,
much more fundamental way. And it's something that we can actually find some fun in. And I want to pivot for a moment because I know that you're doing so much of this work on the ground in a through an organization, through open source wellness, that you're really at the forefront of what this might look like in terms of people accessing care. And so can you tell us a little bit about what that looks like for in open source and how you got started and what your organization is really seeking to offer?
Sure. Well, my journey in some ways parallels you. And really the origin story of this work that has a professional component and a personal component. And I'll try to briefly share both of them. I am trained as a psychologist, and as part of training to become a clinician, you do these year-long internships. You do a pre-doc and a post-doc internship.
Right.
And I did a year of training in a low-income hospital system. And I did lots of things. I worked in an emergency department and I did a lot of work in primary care. And one of my jobs was to observe primary care appointments and provide coaching to the providers, often young residents, about how to navigate the emotional and psychological and behavioral aspects of care. We did a lot of training around motivational interviewing and how to help these providers get out of that should mentality. And during that time, I got really interested in what I now call behavioral prescriptions. Early on, I just called them things that doctors tell their patients they should do. And as I sat in on hundreds of appointments, I started keeping track of what are the behavioral prescriptions that are being given. And to make a long story short, here's what I learned. No matter who the patients are, whether they're struggling with diabetes or depression or hypertension or something else, and no matter who the providers are, the same big four behavioral prescriptions are being given. And I don't think these will surprise you. Here's what patients are being told. Number one, you need to exercise more. No surprise there, right? Number two, you need to eat better. Number three, you need to reduce your stress. No problem, right? Like, sure, I'll get right on that.
Absolutely.
And number four is you need some social support. You need some meaningful social connection in your life. Now, these are all good advice, right? These are directionally correct. There's nothing wrong. In fact, it's highly data-driven advice. The problem is that these prescriptions are verbally delivered at the end of that 12-minute appointment, followed by something that sounds like this. Alrighty then, take care now. I'll see you in 6 months. Good luck with that. Off you go. And that's the end of the conversation. And I remember talking with the person who would become my co-founder, Dr. Ben Emmert Aronson, and saying, my God, if we told someone, like, you're going to need antibiotics, good luck finding them, take care now, that would be so clearly unethical and malpractice. Instead, we say, like, what's your neighborhood pharmacy? Okay, it's going to be ready for you. It'll be dosed for you. Your payer will cover it. Your insurance will cover it. It'll be ready in an hour, right? We have this incredible delivery system for medications, but we have no delivery system for the behaviors, the practices that support physical and emotional and social well-being. And so Ben and I, back in 2016, which is the same year I started at CIIS, set out saying, what would it look like to create a behavioral pharmacy or a delivery system that would support patients in four big things: physical activity, healthy food, stress reduction, and social connection. And we started abbreviating that move, nourish, connect, and be as our big prescription. And part of our commitment was, we're not just going to replicate the boutique wellness system, because if you have enough money to shell out, enough financial privilege, sociocultural privilege, you can access a lot of these things. But if you don't, it's a prescription to nowhere. And so we said, what does it look like to bring people together? I like the word you said, to regather people in supportive, trauma-informed, culturally affirmative groups to practice, move, nourish, connect, and be. And so we started in 2016 in Oakland. We found ourselves a little community space and we started building relationships with the local clinics. Federally qualified health centers are the names for clinics that get federal funding to provide care to people who are uninsured or underinsured, so regardless of their capacity to pay. And we started having these providers refer or prescribe their patients to our program. And this program evolved over the years to be what we now call community as medicine. And this is a 12-week group experience that's characterized by health and wellness coaching that's highly experiential, meaning we don't just get people together and sit in a circle and talk about
Talk
health
about
and
it.
well-being. Yeah, there's a lot of
Yeah.
talking about it in the world.
Yep.
We actually practice these things together. So if you came and visited a community as medicine group, what you'd see is a group of up to 20 people and 3 or 4 health and wellness coaches practicing physical activity, practicing mindfulness, practicing healthy nutrition, and then talking really deeply with each other about what's going on in their health and well-being. And they might be dealing with very different challenges, right? Somebody might be struggling with anxiety. Somebody might be struggling with substance abuse. Somebody might be struggling with their blood sugar levels. But what they're coming in to a community dedicated to supporting each other with well-being and creating safety, creating a space for vulnerability, creating joy and play and laughter. And at the end of every community as medicine group, every patient is writing their own prescription. So this is not what their doctor wrote. They are writing for themselves. Here's what I
Hmm.
want to work on in the week to come. And then they're coming back the following week. So
Hmm.
I just shared a whole lot. Did that all make sense?
It absolutely does. And it so touches on the ways in which we can think of this as fundamental
Mm,
to our lifestyle as opposed to something that we tack on or something that we're purchasing. I really appreciated what you said about how if you have enough resourcing, access is not really the issue at
mm,
all. But there is still this sense of like well-being processes like this as being extra in our life.
mm,
And this 12-week arc that you're talking about, the fact that it's happening over time, so it's really becoming ingrained and it's because in that experiential component, we know that people, when they have experiential learning, they take it in a very different way when it's whole person or whole body learning instead of just like we talked about, talking about it. We're not pointing at the thing, we're doing the thing. And I think that that is what makes such a difference too. And, when I'm working with people around the arts and that, especially with my coaching clients, and I'll give them that first invitation of like, well, why don't we make something? Make something. We're going to do it. We're going to, oh my goodness, right? It can be scary because we see it as either something, it's too new or art is for artists, just like, exercise is for athletes, right?
mhm, mhm,
Good food is for, foodies or cooks or that. There's this way in which we think that like, oh, no, that's not for me if it's not
mhm,
sort of part of our ongoing life already. And so I think this opportunity to be in community and recognize what is for you and what
mm.
feels good and what feels right. And then that idea of writing their own prescription at the end for the week is just so beautiful. It's this way in which people get to say, this is what's important to me.
Yeah, this is
I
what would make a
love that.
difference in my
My
life,
life.
not what my
Exactly.
doctor said.
Right.
Yeah, I really appreciate you naming the fundamental nature of these practices. And I realize, and I shared about my professional arc, but the personal piece that makes sense to share here is that for the last 20 years or so, I have lived in various different forms of intentional community.
Mm.
And the phrase intentional community, people sometimes have visions of communes spring to mind. And I want to say it's not that. There are all kinds of forms of intentional community, including co-housing, which is an awesome Danish model where people have their own little homes, but there's also some shared common space. And because I've had this experience living in community, I feel like I've had this privilege to experience a lot of well-being being baked into the fiber of my life. So for example, a night or two a month, I need to come home and make dinner for a whole bunch of people, and it's a lot of work. But there are other times during the month where I just come home and dinner is made, and I don't have to put
Mhm.
any attention on it. And if I say,
Mhm.
like, guys, I need help, I'm struggling with physical activity in my life, anybody want to walk with me 2 mornings a week? People are going to sign up for that. And so this is an example of my having the experience of without wealth, because I don't have it, and without willpower, because not so much either, there's a lot of support wrapped around my life for well-being. And part of what the idea around creating community as medicine is how do we replicate the active ingredients of that support? Not everybody wants to live in community. Amen. It's a lot of work. But what would it look like to take some of those universal factors, support, empathy, accountability, validation, joy, vitality, that make these practices of well-being feel like fun and not like another should, and then bake them into systems that are very entrenched, like the healthcare system and the insurance system.
Mm-hmm.
Like, how do we create access and equity by leveraging those systems? And in order to do that, you need to generate outcomes data, you need to publish peer-reviewed research. And we've really dedicated ourselves over the last 10 years to building the evidence for this model so that it can be taken to scale.
Right. And you're touching on something that's so important and has been, how when we first started, you were talking about how like you felt like you were shouting into the world of like, this is really important for so long. And the research has really caught up. The evidence base is so deep now that these practices are somewhat undeniable. And I'll use the arts-based practices as an example. So there's been decades of research on the efficacy of arts in healing practices. There's entire fields there's the creative arts therapies that are art therapy, music therapy, poetry therapy, dance movement, all of it, trauma therapy. And then there's the expressive arts, which is this intermodal way of being where we are using many different forms of arts and in different contexts and saying that the engagement is what is important. The process is what is important there. And there are huge bodies of research. But what was missing, or where I really see that there was a bit of a tipping point in people kind of waking up and saying, oh, wow, this really does work, is that the World Health Organization commissioned a meta study. And that what they did was they looked at all of the studies that were being done around the arts and health and said, from all these studies, this is what we now know about what works, how it works, and how we need this in the ways that we frame healthcare. And so the World Health Organization put this huge stamp of approval on the arts. And that was this moment in time where all of a sudden, all of these organizations started springing up and programs started to be noticed all over the country and all over the world. And there was this collaborative spirit of saying, oh, if this is so effective, how do we do more of this? Right?
Yeah.
So what you're talking about how the research actually helps to bring these things deeper and deeper into community. I wish that weren't the model that we lived under. I wish we could just be like, no, trust me, really, it works. Because I think that we lived like that for a really long time. But it's a way in which I think that we can start to honor traditions and honor and that we can help people to remember for themselves. Like, I don't know if you see this in your community as medicine circles. I have this imagined moment in these circles where people might have that awakening moment of, I remember my grandmother's food, or, oh, I remember what it was like to play as a kid, and I want to get back to that body. Or I used to love to color in coloring books. It's like we've known these things in our lives in moments. And so how do we also like re-engage with those playful and open-hearted parts of ourselves when we've kind of gotten into these routines of adulting, if you might?
Yeah, I mean, I love your imagination of what happens, and I would agree with it. The other piece I would lift is that part of what happens when we regather, when we convene in community, is that shame starts to lighten.
Yes.
Right. So going through our healthcare system can generate so much shame, right? Like, oh, there's something wrong with me. I did something wrong. This must be my fault. I don't know what to do about it, etc. And when we convene in community, part of what we learned is like, oh, I'm struggling with this, but he's struggling with that, and she's struggling with that, and they're struggling with that. Like, I'm not alone. Probably not my fault. And we're going to work on it together. That is a piece of the magic that can happen here. I also loved you speaking to the legitimization of the field that's happening through research. And part of our journey over at Open Source Wellness with Community as Medicine was saying, okay, do we want to be a cool Oakland East Bay demonstration, or do we want to try to impact the systems and the structures of healthcare at scale? And it's daunting, but we have said yes to that. And part of how we're doing that is via partnerships with mission-aligned community-based organizations like the YMCAs. So I didn't know a ton about YMCAs until the last couple of years, They're amazing. There's a statistic like 80% of the US population lives within 5 miles of a YMCA. Holy cow, right?
I was
That's
at my Y
national.
this afternoon.
Amazing. Okay, you were ahead of me. And so like let's just paint the picture. Imagine if primary care providers and mental health providers could prescribe people into community as medicine and or other generative artistic well-being experiences that are
Mhm.
delivered at the YMCAs, right? Not everybody wants to hang out in their doctor's office all the time and do these well-being practices there, although some can pull that off. So part of what we are really after is national scale with local adaptation, local cultural adjustment while being in fidelity to a general model,
Mhm.
and creating an ecosystem of well-being where there's clinical care and then there's community care and the two are linked. Does that make sense?
It makes so much sense. And I think for many people, when we start talking about this, and I know it can feel a little bit abstract, like you were saying, that many of us have the experience of, oh, that's not my doctor's office. That I don't have access to that. It becomes a question of how do I find this?
Mhm.
Where do I go? And community organizations can be so important to this. So where I live in my community, our parks and rec system is very, very deeply embedded in the community and is not only geared toward programming for children, it's lifespan programming. And so in my 4 blocks from my own house, there's a Parks and Rec center that has programming every single night for kids and for adults that
Nice.
is movement based, arts based. They have a aerobic or cardio drumming circle 2 times a week where people come and drum, but it's a full workout and it's to playlists and it's out of this world. So it's also the combination of many, many forms that we're talking about. They offer wellness and nutrition programming. And so there's free and low cost programming in many, many communities. But I think it's also how do we get started with that? Or how, if I'm an individual just sort of in my own life, doing my own very busy adulting, as I imagine the vast majority of us are, that question of like, how do I get started? Start in your local community. And if you don't have the time or the resourcing to leave your house, if you have internet connection, there are incredible offerings, free introductory classes and a lot of different things. There's great ways to access different programming. I mean, even the CIIS public programs, they archive everything that's offered. So there's a ton of amazing workshops, even just through our institution alone. So it's also about dabbling a little bit or not recognizing that like we might not be able to find our way into a formal offering right from the very start. I also think that each and every one of us can become a little bit of an activist in our own healthcare environments by saying to our doctors, hey, do you know about social prescribing? Or, hey, what does this healthcare facility do about wellness programming? Like, do you guys offer anything? And it's just starting the conversation from the consumer's end, because I think we've forgotten that we are consumers in our own
Mm.
healthcare marketplace. And so if we start to have a voice, I wonder if we might be able to start some conversations in our home communities as well. It's the activist
Absolutely.
in me. I can't help
I
myself.
love it. I love it. Here we go. Well, both of us are educators at heart, and I know that both of our programs value experiential education. So not just talking about
Yes,
things, but doing it.
yes,
And
yes.
and one of the things I know we touched base on was could we create a microdose, as it were, of community as medicine or arts-based well-being here tonight in this conversation for each other and for our listeners.
Yes. I'm
You
so
game?
game. I'm so excited
Okay.
to do this. Yeah.
Okay. Well, I can offer little bits of some of the methodology that we might use in community as medicine, and maybe you can bring some of your lens and we can co-create this a little bit.
Let's do it. I love it.
Okay. So then my invitation for listeners out there is to just follow along. I wish we could see you and talk to you, but we're going to talk with each other. And if you have a pad of paper and a pen, you might want to jot some things down as we go through this, and then we'll debrief at the end. and have time for Q&A. Sound good?
It's perfect. I love it.
Okay.
Let's do
Okay,
it.
great. Okay. Well, if we're going to start in this community as medicine framework, one of the things we like to do is take a look at different domains of well-being and in a really gentle, non-judgmental way, reflect on where we feel like we are rocking it and where we feel like, oh man, there's room for improvement. You down to do like a little micro assessment here?
Absolutely.
Okay, great. One of the metaphors we like to use is being on the court or in the stands. So if you imagine a basketball court, if you're playing basketball, if you're playing the game, you're down on the court. Now, it doesn't mean you're winning, right? You might be shooting and scoring and falling down and referees and all that, but you're engaged in moving towards what you value. And if you're in the stands, you might be cheering or booing or checking your phone. You're fundamentally not playing the game. And we like to use that metaphor to just help us bring to life, like, yeah, where am I putting my attention and engaged in creating my well-being? And where am I saying that that needs to be a back burner right now? No shame in this, just like cannot put my attention on that one in this moment. So with that said, let's look at 4 domains of well-being. The first one being physical activity. So if 10 fingers up was like, I'm crushing it, it doesn't mean that I'm a marathon runner. That is not the goal. It just means that what I'm doing is working for me. And maybe one finger is like, oh, the couch and I got pretty close in the pandemic. There's a lot of room for improvement. Where would you say you are right now? And I'll do it with you.
Okay. Okay.
I think I'm like
a metaphors right now. I just launched a brand new program this year. So I haven't moved in a really long time, but I went to the gym today, but I am at a 4.
Perfect. Loving it. Yeah, I would say I'm at a 6. I've gotten into pickleball. I know me
Nice.
And the rest of the world. It's
no
so
shame.
much fun.
Yes.
Cliche, but it's there. So I think I'm at a 6. It's like room for improvement, but doing okay.
Okay.
All right. So if you're out there listening, you could just jot your number down. This would be like move and then write your number down. Okay, let's do another one around nourish. So 10 fingers up would be like, the way I'm nourishing my body is working for me. Doesn't mean I'm a superfoods person. It just means like what we've got going on is working. Maybe one finger is like, oh, there's room for improvement. 0 fingers would be like, I've eaten nothing but hot Cheetos and Diet Coke for the last year. Yeah, where are you at on this one? I think.
Well, I am 100% a live to eat person.
Okay.
Food is my thing, but I'm currently at an 8 because I keep forgetting to eat lunch.
Got it. Got it.
But I would be a 10, like in terms of the way I nourish, I am a 10 for sure.
Awesome,
but man, my ability to nourish is at an 8.
Hey, that's really good. If we were in the same group, I'd be like, I'm going to learn from you. What is your trick? I think I'm at a solid 5 here. I feel like I feel good about the food I'm eating. And then I eat so much dark chocolate on top of it that I feel like I maybe like negate the effects. It's like, it's solidly into the addictive terrain.
Fair.
Yeah. So if you're out there, you might just note it, like, where are you? 0 to 10. How's that going? Okay, 2 more. Let's do one about stress and emotional well-being. So 10 would be, I'm a total Zen master, calm, cool, collected. Nothing gets to me. Yes. And 0 would be like, my stress and anxiety and I are close friends. We like to hang out. Where are you at on this one?
Yeah, I would say currently I'm at about a 6.
Okay. I was in the same zone.
Okay. Like I have some really wonderful resources and skills around that. I don't always implement them as much as I would like to.
Yeah.
It's like sometimes I know it, but to be it gets a little dicey.
It's the psychologist's dilemma, isn't it?
It truly is. It truly is.
Yeah.
So I'd say I'm a 6.
I'm in the same range, like a lot of good in my life, a lot of support, and being the executive director of an organization. Man, some days like grant funding doesn't come through and it's a tough day.
Yeah. And we live in a tough time. Even beyond just sort of the day-to-day, we do live in a tough time. So sometimes that can get a little bit, that can have seepage, and I'm not able to say, hey, I need to take care of myself in the midst of this. There's some moments when it's just like, it's too tough right now.
Yep.
So I'm at a 6.
Well said.
Yeah.
Yeah. Okay, let's do one more. This is about love and support and connection in your life. So
Mm,
10 fingers would be like, I'm overflowing with love, support, and connection. Couldn't eat another bite. And one finger would be like, I'm hungry for more, or I want a different flavor. Like, I have this great partnership, but I miss seeing my family, or like, oh, I don't have as much time to be with my friends as I want to. Where would you be
mhm,
on this one?
mm. I would say I am again at about a 6,
Okay.
a healthy 6.
Mm,
It's more of a time and location piece for
mm,
me. I
yeah,
live really far away from a lot of the people that I care about. So,
right.
I'm kind of living on Zoom fumes in a lot of ways. Like I have beautiful community here and there's a lot of love. And sometimes I feel like I'm a little
Hmm.
bit on the Zoom fumes.
Oh, that phrase conveys so much. Yeah, I hear you. I was going to say I'm about an 8. Like I live in
Yeah.
community. I have a lot of support, and I'm on the wrong coast from my family. And especially when my
Hmm.
family goes through hard things, I just feel like I'm in the wrong place. What am I doing over here? And that feels hard.
Hmm. Hmm. I love this scale. I just have to
Mm,
interject here. I love the
mm.
way that you frame this scale in that a lower number is not a shame-based phenomenon, right? Like that it's not about there being a problem here. It's about noticing.
Yeah,
So beautiful.
you can't be a 10 on everything all the time.
No,
It's like
no.
life happens, and I've done this with hundreds and hundreds of people, and that experience of like, oh, it's okay to be struggling in some domains and to have something to offer in other domains.
Hmm.
Well, thank you for moving through that with me.
Yeah, thank you.
We like to do that because it helps that shame start to melt off. And then if I were to guide one more sort of little imaginal activity, you want to follow along with that?
I am totally with you. Let's go.
Okay. Okay, great. So I invite you to just be comfortable. If you like closing your eyes, you can or not, just whatever works to you to take your attention inside for a
Hmm.
moment. And I will do the same. And I invite our listeners to follow along as well. So just take a moment to check in to your body, your being, just noticing what it's like in there. And speaking of Zoom, we're going to go on a little journey of imagination. And I just really encourage you and everybody listening to do what works for you here. So if following along with me feels good, great. And if at any point you're like, oh, that's not for me today, wonderful. Just come back to being present and supportive with yourself and caring for yourself in whatever way works for you. So, if you want to follow along with me, I invite you to imagine that you could zoom out from your life, like you're zooming up and back, and you can see your whole world down in front of you. And then, using this magical zoom power, take a moment and zoom in on some domains of life where things are going great, where there might be fulfillment, gratitude, abundance, love, nourishment. Let's take a moment to marinate in that. And then, if it feels okay to do so, I invite you to zoom back out and then zoom in on the domains of life where things are harder. If you're human, there are probably domains of life where there's frustration, grief, loss, fear, or where you just don't know how it's all going to work out. Just take a moment to be present to that. And then, if you're still following along with me, I invite you to call to mind the most unconditionally loving, supportive, benevolent being you've ever met or never met. This could be a person living or passed on, a spiritual figure, just someone who knows you or knew you, has your back, wants the best for you. And if you imagine that person, imagine that somehow that person or being knows or could sense all of what you're going through, all of what you're holding right now, the good, the hard, the fulfillment, the worry. What would this person or being have to say to you? Like if they could write you a letter or send you a voice memo, what words of perspective, of wisdom, of support would they offer you? If you're out there listening, if there's something that comes, you could jot it down. And Christine, I'll share with you that when I do this, almost every time, the person who comes to mind is my grandmother. She died just about a year and a half ago. And what she has to say to me is, Elizabeth, you are already doing enough. It's enough. That's what showed up for me. Curious if anything showed up for you that you would feel comfortable sharing.
Oh yeah, absolutely. A very dear colleague and friend, someone I've spent
Mm,
almost 25 years with now, professionally and personally,
mm,
came to mind very quickly. And this is something I've actually heard in real life, and it came immediately. You know, this person has shared with me or said to me more than once, "You are a gift in this world."
ooh, ooh,
And
potent.
I know it's so,
Yeah.
it's such just such a wonderful thing to kind of rest in and remember.
Mm-hmm. Thank
Yeah,
you. Yeah.
yeah. Well, thank
Well, we've
her for
been,
saying it out loud. I
yeah,
mean,
yes. I know it's funny about this. It's like they said it, but also I said
but
it, so
here
it's
I
in
am.
me.
Yeah,
Yeah,
yeah, it's
yeah.
beautiful. Yeah,
Well, we've been in the community as medicine mode here, and I'm curious about
yeah.
how you would pull this forward or through from more of an arts-based.
A moment for that. So we've just had this imaginal realm moment, which is what we'd call it in the arts-based work. And we use a lot of symbol and metaphor
Mm,
in our work. And so a way that we talk about keeping something like what we learned from our friend or from our unconditional loving being is to create a symbol or a metaphor of that message or of
mm,
that person. And so, you know, when I think of this person, I think of candles
mm,
and sort of the like a candle that's always burning and it's got like the most amazing smell and it's got the flame is always on, but it doesn't get too hot. The glass doesn't get too hot. It's just sort of this always burning candle. And so for me, the
mm,
symbol of an eternal candle is something that has a lot of gives me a place to anchor into, and it's got a lot of sort of meaning for me
mm,
in the sense
mm,
of like the light of it, the scent of it, the how it captures my attention. And it makes me remember you're here in the moment, wake up. And so I invite you, is there an image or a metaphor that comes to mind, a symbol that comes to mind that helps you to really be like, if I think of this symbol, I will think of that message.
You know, it came to mind immediately as soon as you started talking about a
Mm,
symbol, and it's this image of my grandmother's hands.
mhm,
And they are, you know, they're old and veiny and spotted, but I also
mhm,
associate them with so much love. And um, yeah, there's something about like, hey, we are all on in the process of getting old, and there's something about that sense of enoughness of like, stop, be here. You're
mhm,
doing enough, you're being enough. Like
mhm.
there's something about that in the image of or this the even the tactile memory of her hands that stands out
Right.
for me.
Yeah. Yeah. And so using these as examples that, you know, to the people who are listening along, I really invite you to, if it doesn't come naturally to you, if a symbol doesn't immediately pop up, another way that you can approach this is wherever you are, whatever your environment is around you, look around.
Mm,
What grabs your attention? What grabs your eye? What do you see? So, for example, when I look directly up, I see these amazing cacti. that are growing in this planter. And the cactus is such a great image of resilience and strength and sort of toughness. And I really love cacti. I have them sort of all over the house. And so when I look at that, that's another image or symbol. And so if you look around your space, there might be something that captures your attention. That's another way to find a symbol. And then if it works for you, wherever you spend a lot of time in your home or what have you, find that image, print it out on your computer, or maybe you have, maybe you're a frog collector or you have elephants all over your house and they're important to you. Grab that symbol and put it nearby, and allow yourself to remind yourself, engage with the symbol. And Carl Jung used to talk about the fact that, like, when we start to work in symbols and work in metaphors, we start to see them everywhere. So notice if you start seeing the hands of the elderly. Notice if hands start to have a different flavor or tone for you. I'll be noticing candles probably over the next couple of days. And that's our gateway into the message that we need to remember.
I like that. That's our gateway.
Our gateway, right? Our symbol becomes, I see the candle, I remember I am a gift in this world.
I love it. Okay. Great. Well,
Yeah.
is there one? Yeah. And then how would we pull this through from, okay, I have this symbol, I'm looking for it in the world. How does that then become, I'm changing my life. I'm creating well-being for myself. I'm
Right.
making a difference.
Right. This is where I go back to the start small piece again. So instead of saying, I'm going to pick something in every single domain, when I would be working with someone and when I'm working with myself, I would say, okay, when I was doing my assessment, which of those categories did I score the lowest in? That probably would be where I started. So for me right now, it's movement. And scoring a 4 is not where I'd like to be. Ideally, I'd love to be more along the 7 or 8 line, let's say in the next couple of months. It's not going to happen tomorrow. It's not going to happen by the weekend. But in the next couple of months, how can I get myself to a 7 or an 8? How can I take that burning flame in me? And how can I ask myself, as a gift in the world, how can I incorporate more movement so that this vessel that the gift resides in, that the gift is, can get stronger and healthier and more active and more engaged? And so that's how we might take it. So if your symbol is hands, what do these hands need to create in order for me to take that next step?
I love that. Yeah.
Or how might these hands guide me? Whatever way it works for you. Sorry to interrupt you.
No, this is great. Yeah. Yeah. As we start to wrap up and move towards question and answer, I think, if we were ending a community as medicine group, the question would be something like, if you were your whole life's doctor, not just your body's doctor, but your whole life's doctor, what would you prescribe for yourself? Right. And I can even imagine it being like, you're like, what is this symbol prescribe for you? What would be the guidance or the short script? And so if you're out there listening and you're inspired to write your own prescription, I sometimes hear from people 6 months or a year or several years after a session like this, and they say, I wrote a prescription and then I taped it on my computer screen and it's been with me all along as a reminder of what my intention is and what my commitment is.
Would we like to share our prescriptions right now?
Okay. Yeah. Okay. Do you have yours?
I'm going to make it up on the fly, but I think it's really there. Are you ready?
Okay. Yeah.
Okay. 4 days a week, I'm going to light a candle and I am going to devote 5 minutes of movement, whatever that looks like, to myself as a gift. I am going to gift the gift. And in those 5 minutes, I am going to just allow myself that time and space with my candle lit to remind me that I am worth that commitment to myself.
Thank you. If I were your coach, I'd be writing it down and I'd be texting you in 2 days going, how'd you do?
Accountability buddy.
That's right. Yeah, okay, here's what comes for me. If I were my own life doctor, my prescription would be something like every night. I know it's ambitious. I'm just like every other client who's feeling ambitious.
Good.
In addition to the running commentary in my head of like, okay, tomorrow I got to do this, or here's what didn't get done, or like, oh, I forgot about that. I want to take a very intentional 2 minutes and put my attention on what did happen in service of enoughness. And and in looking back when my hands are old, not at what I failed to accomplish or what we didn't complete in our mission, but to take a moment to metabolize the goodness of all that has happened. Like
Hmm.
I can't every day feels hard, but in 10 years we've accomplished incredible work, both in our teaching and in our community as medicine work and in our arts work.
Hmm.
And so my prescription is to just take a moment to let myself be nourished by that.
Hmm. Right. It's another form of nourishment.
It
And it
is.
really is that core component of being. And it also ties into belonging in a really interesting way. How did I
Mm,
belong in the world in this way
mm,
that
mm.
meant something to me and made a difference?
I love that.
Me too. That's beautiful. Thank you for sharing that. And if I were your coach, I'd be texting you and being like, have you been gentle with yourself and remembered to celebrate what did happen?
Yeah, thank you.
Yeah.
Well, I know we're sort of completing this little experiential segment.
Yeah.
I'm
Yeah.
curious about what it was like for you to do that.
Oh, it's another one of those examples of like, I don't get to do this as much as I would love to
Mm,
in my own
mm,
day-to-day life. So what a treat to be able to learn from how you all are facilitating community as medicine processes and to know that you're doing this in the world with other people is so exciting. But to be able to experience it for myself is also a reminder that this is something we can do every single day. And it
mm,
doesn't have to be overly ambitious. And it can be a moment in time that we can then just continue to build on and carry forward, and that there's a cumulative effect to this
mm,
kind of work, to
mhm.
our own self-prescriptions. If we stick with it, if we're good, compliant patients, we can really see results.
Oh man, I don't know that I'm very compliant as a patient, but maybe when it's my own prescription, I will
Yeah.
feel moved to.
What
Yeah.
was it like for you?
Yeah. Um, there's something touching about it, no matter how many times I do this kind of work. And
Mhm.
what's catching my attention is the art or the symbolic piece. We have in community as medicine, we call them sparks. They're like interactive lessons or topics that we'll bring each week. And we have
Mhm.
a spark that we call Toolkit for Hard Days. And the idea is to just help people create their own little tool basket virtually or physically to support them through
Mhm.
hard days. And I've been thinking about this symbol or this artistic piece that we could add to that I think could be so supportive of like, when I'm having a hard time, I go back to my representation of what I'm here for or what sustains me or what's good in my world. So that's what I'm taking
Mhm.
away. Thank you for that.
Yeah. Oh, thank you.
Yeah.
Yeah.
Well, I feel like we could just talk for hours, but I know we have some questions coming in. Is it okay if we start to pivot to those?
Absolutely. Yeah, I think that would be great.
Oh my goodness. Where should we start here?
Okay, let's
I've got one
see.
for you if you're open to
Okay,
it. I'll read you
yes.
one. Okay. How do you support creative desire when people feel they don't have time or capacity for it?
Mm. Ooh, well, that's a brilliant question. I am really into the concept of time. So when I'm working with my clients, I actually will ask them often a question like, what's your relationship to time? We don't really think about time in that way. We don't think
Mm,
about having a relationship to time. Oftentimes, I think we think of time as something that we lack. Time is something that we have to grab. Time is something that drives us. And so, starting with what's my relationship to time
mm,
can shift our perspective in a way where we can really start to realize that, like, maybe this way in which we think that we have to make time to be creative might be a stumbling block in itself. What if everything we do already is creative? What if we are simply creativity in motion by being alive, first and foremost? So it's also about changing our relationship to the idea of creativity, or changing our relationship to this idea that I have to create something. And just by being alive, we are creative fundamentally. So that's one way that I often work with clients that can help them kind of loosen up some of the uncertainty or some of the lack of motivation. Another piece is around capacity. That word makes me curious. I would immediately just become curious about, like, what does that mean? Is that about like not having the learned skill for a particular form of creativity? Is that about not having the resources? Like maybe you don't own paints, or maybe you don't, you haven't taken dance classes or what have you. So what does capacity mean here? And that would be another place that I would start. And so part of the supporting is simply remembering that the world needs our version of creativity, that we have it within us to hum. We have it within us to use our bodies as an instrument in whatever form our body comes in. If we have an ability to use our limbs, we can create music immediately. And so it's also about, again, just being in the moment and saying, what's my definition of creativity? And if the answer is, I don't know, that's my favorite response in coaching. I actually just wrote a whole book chapter about I don't know, because I don't know, in my opinion, is actually a form of resistance. When people don't fundamentally know, they say things like, that's a good question, or, oh, I never thought about that, or, oh, I never learned that before. But when I don't know comes up, it usually means like, I'm not going to talk about that right now. And so if I don't know is coming up, or I don't know how to start is coming up, get curious about the I don't know part. Get curious about, like, what does it mean to not know? What is it that I don't know? What is it I don't know about creativity? Or what is it that I don't know about my own desire? And like you mentioned, instead of that having to be a problem, what if it's an invitation to write a story about I don't know? What if it's an invitation to go through a magazine and pick out 11 words that stand out to you and make a poem out of that, just for fun? And so there's this way in which I think we also have to break through the expectations that have either been set for us or we set for ourselves around what creativity means. So that would be my approach, but I'd love to know how you might approach this conundrum.
I love it. I think actually what I want to double click on is the way you just spoke about resistance, because sometimes I hear the word resistance used in a way that's pathologizing. Like, oh,
Absolutely.
that client is resistant, or
Right.
why
And
am
we
I being
must
so
overcome
resistant?
it.
Yeah. And
Mhm.
what I want to just highlight is that your response to, what you interpret as resistance is not to push harder, or is not to be annoyed or anything. It's just to get really, really curious.
Yeah.
Like, oh, tell me more about that.
Right.
And
Right.
we don't have to get all deep and psychological, but when we're resistant, we are protecting something, right?
Right.
We are
Exactly.
protecting. There's some part of us that senses going here might be dangerous,
Right.
right? Or deeply uncomfortable, or there's a reason that we protect or we resist things. And so meeting that protection with respect, with curiosity, with honoring, and with some gentle perseverance, I think is really supportive. Yeah.
Absolutely. Yeah.
Yeah.
Yeah. And there's a whole body of research on play and the fact
Mm-hmm.
that the vast majority of adults do not know how to play and do not play. And I
Mm.
think of play and creativity as really going hand in hand. And all play is an activity done for the sake of the activity. It's sort of purposeless
Mm-hmm.
activity
Mm-hmm. Mm-hmm.
where it's not monetized. It's not part of our profession or our labor. It's just done simply for the act of doing the thing. And if we
Yeah.
think of creativity as a form of playfulness, maybe that's a gateway. Again, I love that concept of gateways, right? So maybe it's a gateway into getting in touch with our creative desire. If we can just do
Mm-hmm.
the thing simply for the purpose of doing the thing, as opposed to there needing to be a product from the process.
I love that. I'm feeling drawn to one of these other questions. Is it okay to dive in there?
Yeah, let's do it.
Okay. I see a question that says, what are the most common barriers you see that people face when trying to build genuine connection? And how do you help them move through those?
Mm.
Man, we could write books and books and books on
Oh,
this.
yes. I would
Yeah.
love to hear your take on this.
Okay. Well, I'll start and then I'll be interested in your take as well.
Okay.
Okay, so I would just invite, we're going to bring the same spirit of curiosity here because this is
Hmm.
tender terrain.
It is.
I would invite anyone out there to think, how did I learn about connection? Like, how did I, as a social being, learn how to connect with other people? And if you ask somebody this, they will pretty much go back to some early life experiences where connection was modeled for them. It was offered to them or not offered to them. They
Hmm.
watched connection happening between the adults and the other children in their family. And then they went to school. And most of our learning about connection is implicit, not explicit, right? There's not a
Hmm.
ton of like, let me tell you now how to connect with another human being. I wish there were a little more explicit learning, but it's
Absolutely.
all implicit. And so we learn things like this is acceptable, this isn't, this is safe, this isn't, this is what good little girls or good little boys do, and this is what earns them love and attention and connection, and this is what causes people to withdraw from
Hmm.
connection.
Hmm.
And to be clear, when we are young, somebody withdrawing connection from us is dangerous, right? If we
It's
weren't cared
life-threatening.
for, we don't
Yes.
make it, right? And so
Right.
what if you think like, well, what's the big deal if somebody withdraws connection or rejects us or avoids us? To younger parts within us, that is a big, big survival level deal. So
Hmm.
in that developmental process, we form what I like to call a connection blueprint, right? It's just an inner
Hmm.
working map of how connection works. And within that are some core beliefs or some understandings about who I am, how the world works, how other people work, etc. And so then we take those blueprints and we kind of look through them like sunglasses as we move through the world. And that directs how the world occurs for us, right? If you're wearing blue glasses, everything looks a little blue. If you're
Hmm.
wearing glasses that say um, people seem nice but they turn on you at any moment, or you will only be loved and supported if you are kind and pleasing and self-effacing, etc., you're gonna operate through those instructions, and
Hmm.
that will drive how you seek connection. It will drive how you are able to metabolize and absorb the connection that's right in front of you, and it will
Hmm.
continue to self-reinforce your stories about connection in the world. So I realize this is a little bit of a deep dive, but part of what I like to help people do when they're saying something like, I want more connection in my life, or I'm not happy, I'm not socially fulfilled, I'm lonely, I'm isolated. Um,
Hmm.
what I like to help people do is look at the external circumstances. Like, are there literally not human beings around you that you get to interact with? And then also to look at our own blueprints, to look at our own capacity to absorb and digest and metabolize and be nourished by the experiences of connection that we are having. And that I think in a curious, open, non-judgmental excavation of all that, amazing things show up and new possibilities for action become available. Right? You
Hmm.
might not have been able to say, "Hey, Christine, I think you're amazing. Could we be friends?" But when you've done some of that inner reflection, suddenly that becomes a new possibility that you could undertake in your life. And from there, whole new things open up. So
Hmm.
that was a long way around. I'm curious what shows up for you
Oh my
around all of
gosh. Well,
this.
first and foremost, the relational blueprint thing is going in my toolkit. I
Mm,
love that
great.
image. I think it's so important. And it also, I think, offers us a way to recognize that we might need a new design, that we might need to find another designer or architect and find a new way to recreate some blueprints. You know, for if the
Hmm.
design is like off kilter from where we are in our life right now, how do we also go come into a moment or an invitation with ourselves to redesign our blueprint? You know, how you were talking about this ability do some self-reflection, and not from a place of like there being something wrong with my relational style. Like, let's first and foremost not start there. And let's recognize that maybe you've just ended up in a place that isn't the place that you want to be. And so the invitation then, or the recognition becomes, well, how do I want to do this differently? And then it becomes also about learning some new skills. And this is when I go to some of my best friends in the professional world, which is emotional and social intelligence.
Mm-hmm.
And really looking at the fact that what gets called emotional intelligence and social intelligence are actually a learned set of skills. This is not something that we're born with and we have like a set number to. And
Mm-hmm.
so recognizing that we might be a little out of whack with some of our emotional intelligence skills. And so there are things that we can do to serve ourselves that will then have this wonderful cumulative effect of people seeing us differently in the world as well. And so where I go with that, and when I'm working with people who are feeling disconnected, is that sometimes we start with like, well, what do you notice about yourself? What's your capacity for self-awareness, not self-criticism? This is where I have a really big distinction between being self-conscious and self-aware. This isn't about the inner critic coming alive and making sure that like every wrong thing that I do is like tallied up in a list, but it's about having that set of skills that can say, oh, I notice I get a little bit nervous when I am in X, Y, or Z environment. Or, oh, I notice that I get really out of whack when I talk to this certain relative of mine that like I'm really having a challenging relationship with. And
Mm-hmm.
then from that data saying, what do I need to learn about how to take care of myself so that when I engage with others, I'm putting forward the parts of myself that I feel I'm really happy with or that I enjoy, that I want to share with other people, and that I'm coming from a place that is like to the best of my ability, as authentic as I can be in the moment. And this is where the caveat comes in. Well, also having some good boundaries.
Oh,
Like I don't have to share all of myself with everybody to create connection. I can have a
yeah.
variety of different connections with a variety of different types of people and types of relations. And not everybody is going to be my best friend, but that barista in that coffee shop, I'm coming right back to them because what we know is that these are called consequential strangers in the
Mm-hmm.
social sciences, and that consequential strangers can be a wonderful starting place if you've been having a long period of disconnection.
Mm-hmm.
Sometimes we need to warm back in to our connective tissues, to our connective self.
Yeah.
We can't kind of dive right in because then we might be so out of practice that we struggle with our own boundaries at that point.
Yeah.
So
I love that you brought
practicing in
up.
small doses.
Yeah. I'm so glad you brought up boundaries here.
Yeah.
I often use this metaphor of nourishment to think about connection because,
Yes.
in my mind, when we say something like human beings need connection, it's sort of like saying human beings need food, which is a true statement. Like, yes, human beings need food, but we're so far beyond that in our conversation about food, right? We're beyond saying calories and macronutrients. We're beyond vitamins and minerals. We're into the gut microbiome and adaptogens
Hmm.
and peptides. We have so much nuance and research and rigor around exactly what, when, and how to feed human bodies with food. We don't have all that nuance and research and understanding of exactly what kinds of connection nourish human beings. Like
Right.
we don't have it built out yet. And I hope you and I get back on here in a few years and we have, the
All
macros
the
of human
science.
connection. I know.
Yes.
May we get there. But some
Yeah.
things we do know is that it's about ingesting human connection, right? Having literal contact, whether it's virtual or physical, with human beings. And then it's about
Right.
being able to actually absorb the nutrients of it, right? So you could engage the barista and have very, very little nourishing connection happen, or you could have a gloriously high vitality, high vulnerability, beautiful connection.
Right.
And you could, if you didn't have good boundaries, you could absorb some things that weren't so good for you. right? And
Right.
so just like our gut microbiome and our intestinal wall, its job is to say, like, I want this in and that out. And when our intestines get a little leaky, that's not so good. I think it's the same around connection, that
Mm-hmm.
part of our job is to develop that discernment about, like, ah, yes, I take this relational experience and this connection in, and to that I say no, like
That's
that
not
is
my
not,
thing.
that's not nourishing. In fact, that might be
Right.
toxic for me. So
Right.
yeah,
Exactly.
thanks for opening
Yeah.
that up. Yeah.
Yeah. There's a question that's related to this, and I'm going to read
Great.
the question to see if there's any nuance we missed. You ready?
Okay. Perfect.
For someone who feels disconnected or emotionally flat, what is the first
Mm.
doorway back into connection and creativity?
Well, you have said so many times, like, hey, baby steps, find the thing that feels easy, right? If it's not going to the gym, do you think you could walk around the block? How would
Mm-hmm.
that be, right? If it's
Mm-hmm.
not painting, like, is it doodling? So I want to say yes to all that. And then just to, like, add nuance over here, or add another frame of the tree. Um, Sometimes it's really hard for us to just change our lives independently. And something that helps us, I'm going to use the word container, and it's a little bit jargony, but
Mm-hmm.
in this space, a relational or a practice container is a facilitated experience where another person or group of people are going to set guidelines and create some safety and shepherd you through a process. And
Mm-hmm.
so a container could be, we did like a 15-minute little container where we kind of guided each other through something. There are all kinds of social and personal development and artistic containers out there in the world, like
Absolutely.
a weekly class,
Right.
like a weekend retreat where you are going to be with some other people, and some leaders are going to support you in going through a journey of tackling the desire to withdraw, or the anxiety, or the poor performance pressure,
Mhm.
or whatever it is that gets in the way. These containers can sometimes take us past the place where we might take ourselves, and we do have to practice discernment and good boundaries, and knowing, is this for me, or is this not for me?
Mhm.
But I mean, I think this is what good coaching or good therapy can do. It's a kind of container that helps people do what they would have a hard time doing on their own.
Mhm. Yeah, absolutely. I love that. And I think that finding a frequent group or a regular
Mm.
group in your home community is an amazing first step. That might be spiritual community. That might be, like you said, a class of some kind. That might be a support group of some kind. 12-step
Mhm.
programs for certain people are incredible community, and can really create that sense of connection after a period of disconnection that may be related to some form of substance use. So there's all kinds of ways that we can think about this. Another piece that I think is really important is what I like to call the self-love project,
Nice.
which is that sometimes we forget that our primary relationship is with ourselves. And when we're feeling isolated, we really oftentimes forget that our
Mhm.
primary relationship is with ourselves, because loneliness, and I think this is so important, and maybe this will be helpful for some people who are feeling a little bit disconnected. John Cacioppo, who did a ton of research on loneliness, the formal definition of loneliness is not being alone. It is the
Mhm.
perception of social isolation.
Mm.
You can be in a room full of people and feel lonely because you're perceiving social isolation. So
Yeah.
the primary relationship with the self can be really, really helpful. So acts like journaling can be useful. Ways in which we can kind of get in touch with what's going on internally and get it out of ourselves can be a really helpful first step. Another thing would be um, picking someone like the beloved other, like in your meditation,
Mm.
and writing a letter to that person. And then also inviting yourself to write a letter back from that person and do a letter writing process where, it might still be in your imagination, but you're starting to warm your system back into
Mhm.
being in a safe and comfortable relationship. And we might need some practice with that if we feel like we've gotten so far out of it. And so we need to tune our instrument so that we can attune with other people too.
Yeah. Yeah.
Yeah.
I love you naming, like, you could be surrounded by people and still feeling lonely. And I think that's part of what I hope for our system, is that we don't just say, people need more social contact, because just being around people doesn't necessarily create social nourishment.
Right.
Like if you're not sure, like, remember your last trip to the DMV? Like, there were a lot of people in that room, and you probably didn't have a socially nourishing experience, unless you are a
Exactly.
wizard of social connection, in which case, teach me. And so,
Right.
so I think part of our
Right.
job, like part of our job, is to design social spaces where the conditions are right for actually nourishing social
Right.
experiences. Yeah.
Right.
And
Yeah.
there's a whole emerging field of study of experience design and design for social well-being that says, you know, if we were thinking about human connection the way we think about food, where we have whole delivery systems built out to make sure people always have access to food, not that we do a perfect job or an equitable job of it, but we
Right.
have some attention on it. What would it look like to bring a fraction of that attention to human connection?
Right. And what's so interesting about this, I've been sort of in the world of what's often called the science of friendship for about
Mm-hmm.
15 years now.
Yeah.
And the first lab at a university devoted to friendship just recently opened. Like,
Oh,
let that sink
nice.
in. So we have all kinds of research about romantic relationships, and we have all
Mm-hmm.
kinds of research around family relationships. We have very little understanding about how people form friends and keep friends.
Yeah.
But there are a couple of factors that we already do know. Maintaining friendship requires a couple of things, making and maintaining friendships. It requires some kind of shared value or shared
Mm.
interest. It is very hard to make friends with someone that like we just do not share anything with. So starting out with trying to make relationships with people that are like your absolute opposite might be a harder project than you really want to start off with, right? So that's one thing, is look for
Mm-hmm.
common interest, repeated exposure. We rarely make friends in a one-off. So we also have to really dedicate time to maintaining connections. We have to be purposeful in the process, and it can't happen like once every 10 months and really solidify. We need like regular contact. So that's where things like that group environment can be really, really
Mm-hmm.
helpful, because we need repeated contact for our nervous system to be like, oh, I'm actually forming a connection here. It takes a little bit of time for many of us to warm in to the connection. And so we really don't know how friendships as a systemic way of being form and maintain, except for these two common elements. And so if you're also like, how do I make connection? Remembering like, okay, let's start with a common cause or a common purpose. Like, let's start there as like
Yeah.
an inroad. And then I need to do this more than once for me to make connection. We can't just go to some, I don't know, rally or some event and be like, I didn't make any connections. That was a fail. It's like, do it more than once.
Yeah.
Rinse
Yeah.
and repeat is a big part of the change process, no matter what it is.
Yeah, I mean, just like you don't go to the gym once, right? Like it isn't a once thing; it's a practice. I, I appreciate you naming how much attention there is on romantic relationships, because yeah, there's a whole attachment theory world. There are an infinite number of books and practices and publications about attachment theory, but it's pretty focused on a primary romantic attachment. And I hope that whether we call them connection blueprints or something else, that we start putting attention on, like, what are people's capacities to connect, to form connections, and to be nourished by those connections.
Exactly. Right.
I'm seeing another question here. Is it
Uh-huh.
okay to
Yeah,
kind of
yeah.
dive in?
Please.
Okay,
Yeah.
this is a big one. Ready? Okay. How do you see individualistic driven systems, often rooted in dominant cultural norms, impacting our connection and well being? And then there's another question that says, how can this work respond to that, particularly across diverse communities?
Mm. I mean, this is the work. It's so beautifully articulated here that it
Yeah.
stopped me a little bit in my tracks.
Mm-hmm.
Um,
Yeah.
I
I
think,
can. Mm,
yeah, go. You were right
yeah.
there.
Yeah. I think this shows up so profoundly in the health and wellness space that people walk out of their doctor's appointments hearing, okay, wait, I have to exercise more and I'm supposed to eat healthy, which means I have to somehow get to the store and get organic vegetables, and then I'm going to take public transit home, and then I'm going to cook them and prepare them and feed the kids and help with homework and deal with my multiple jobs very possibly, and my housing, which may or may not be super supportive to this, and get the kids to bed, and then I'm supposed to meditate and go to the gym and see my friends. Like, are you kidding me?
Right.
Right? The prescription sounds good, but really it's a prescription for an experience of personal failure and a
Hmm.
sense of shame. And people don't go back to their doctors and say, Doc, your prescription is crap because you don't understand the social determinants driving my life systems. They say, I didn't work hard enough, or I didn't have
Yeah,
the
it's
willpower, or
my fault.
something's, yes, they say something's wrong
Hmm.
with me. And then they don't go back to their doctor because why would they? If they're getting prescriptions that are inapplicable to their life circumstances and no delivery system to support it, why would they re-engage with that system until they have to go to the emergency room? And so this is why I'm a big fan of coaching over education, right? Like my sense is like information is cheap, right? And another app that's like, do this, do that, let me tell you what to do, may not have any resonance with the cultural or economic or social reality of the person that it's intended for. But coaching, good coaching, not crappy coaching, but good coaching says, tell me about your world. Help
Yeah.
me get it. Your doctor said this, and this is what your life looks like. Let's work on it together. And this is the spirit you've brought, Christine, throughout this conversation of let me lead not with an injunction, but let me lead with curiosity.
Absolutely. Absolutely. And I think too that what we're really pointing at is the myth of normal, which is a Gabor
Mm,
Mate book, but also is a way that we can start to think about the fact that cultural norms as a concept is problematic. What do we mean
mm,
by that? And what do we mean by cultural in this context? And this is no knock on the question. It's more that it's highlighted for me and really forefronted the fact that when we start from this basis that we're putting people on a spectrum of normal, we've already fundamentally failed at the project of recognizing that people have vast amounts of complexity in their
mm,
locations of identity, in their lived experience, in their resourcing, in their social lives, in their professional lives. And so we also, like you're saying, if we can stop thinking of things as, well, it works for many, so it will work for all, which is what we do in
mm,
in medical treatment often. Um, and then what do we do with the outliers? We say, oh, I don't know how to help you.
Or
What if
worse,
we
we say non-compliant or
client?
something like
Right,
that.
right, exactly. And so
Hmm.
instead of adopting that as part and parcel of this model, I think that what we're talking about is that in this shifting landscape of how we think about health and well-being, we have to really recognize that operating from a framework that there's a set point of normal is the first fundamental flaw. And what if
Hmm.
we stepped away from that and, like you said, get curious about what people's lives are actually like?
Yeah.
And
Yeah.
so I don't know in my lifetime if we will dismantle the individualistic drive of the systems that we currently have. I can hope. I take a lot of inspiration from Rebecca Solnit, who is like the
Mm.
most, optimistic person in the face of social change. And I learn a lot from the way that she frames that we can be persistent in the ways that we practice and we can model in the work that we do, and we can bring others together and have conversations about how we can enact change. And that's really the starting place.
Yeah. I'm reminded of that quote. It says, "It's not a marker of health to be well adapted to a sick society."
Right.
And I think it's the performing, being well adapted and having it all together and being an individual success that is a disservice. And part of why I'm glad you and I are walking through our own strengths and challenges in well-being here in a pretty
Mm-hmm.
public way, and why my whole life's work is about, can we bring people together and find commonality and safety enough to be vulnerable about what's hard about living in this particular moment, whoever we are.
Right. Right.
I'm seeing one last question. Okay, to
Okay.
toss that out there.
Yeah, let's do it.
Okay. What are some recent examples of you putting these methods or ideologies into practice that have helped you and or brought you joy?
Hmm. I have one like right away.
Let's do it.
Okay. So last week was spring break,
Mm.
and I actually took spring break. I don't always do that. Oftentimes I'm grading papers or doing the work, and which I love as well. But this time I
Mhm.
said, I'm going to take a break. And my partner came to me and she said, I have an idea for spring break. And I said, okay. And she said, what if we did 5 art projects, things we've never done before, in 5 days? And so the Friday before spring break kicked in, we went to Michael's and we bought crafting supplies that we didn't already have. And we picked out like 5 different projects. We only got to 2 of them because they took way longer than we thought that they would.
Mhm.
But we spent 5 days at our kitchen table doing projects that we would first and foremost never make, never, we wouldn't make time for, quote unquote, right? And that we didn't do for the sake of having a product, but we just did to be in the creative activity.
Mhm.
And so my staycation was less about, couch surfing and catching up on my shows, which isn't a bad way to spend some time either, I won't lie. But it was such a creative spark and it was so rejuvenating and it brought so much joy. And I had a rag rug that I dismantled and tore apart. We took all the fabric from the rag rug and made like fat fiber art out of it and that kind of thing. So it was also like, yeah, we had a couple of things we needed, like a compass, but we didn't go
Mhm.
extravagant on the materials either. It was like, what can we find? And then how can we just spend some time? And it was also relational. Doing it
Yeah.
together was like such a special way to spend time and so out of our typical routine that, and since then there's been this awesome knock-on effect of like in passing through both work from home, doing the like, I have an idea for our next project, or wasn't it great, or we need to buy frames for that thing we made. So that's brought me a lot of joy recently.
I am impressed both about the crafting and the taking spring break. So,
Thank you.
next year, next
I'm here
year.
to model.
Thank you. I appreciate that. Here's the one that comes up for me. On our team at Open Source Wellness, we have a practice of starting meetings with check-ins. And I
Hmm.
know this sounds like the most basic, silly, like no big deal thing. But in those check-ins, we had one today, people get real. And our team is it's a funny crew. We've got people being like, perimenopause is kicking my ass, it's really hard, and we have people
Hmm.
being like, like my mother-in-law is dying and I'm traveling to be with her, and there's just the whole gamut of human experience that gets named in that. And I think that came up for me because even though it's my professional world, we are also just making space for the reality of life to be happening.
Hmm.
And that brings me, sometimes it's joy, sometimes we're laughing a lot, and sometimes it just brings me a sense of like of a humanizing of like, yes, I'm here with my title and my role, and before we get into the work, we are with each other in the realness of our life experiences, and that feels like medicine to me.
Hmm. That is really medicine is connection.
Yeah. Yeah.
Yeah.
Christine, what a joy to talk with you. I
Oh
can't
my
believe we've worked
goodness.
at the same university for 10 years and not had this conversation before.
I know, and I'm so grateful we've gotten to have it. Thank you so much for being part of this conversation. I've learned so much from you, and I can't wait to see where you take open source wellness next, for sure.
Likewise. Hey, if people want to learn more about your program or what you're up to in the world, where would they go?
Yeah, so the Expressive Arts Coaching and Community Building program is on the CIIS website. So you can go right there and search for us, and we're there. And they can also find Community Mental Health, the program that you teach in, on the CIIS website as well. But how do they find open source wellness?
Yeah, opensourcewellness.org is our website, and there's all kinds of different training programs. There's our YMCA programs. We currently have an open call for applications for YMCAs around the country who want to deliver community as medicine, and lots of resources to be found there. And yeah, as you said, I teach in the community mental health program. So students who want to become therapists who are oriented towards issues of power and privilege and community and systems and structures, that's another place to dive deeper into this kind of conversation.
Very good. Well, thank you so much, Liz. What a
Thank you so, so
joy.
much. What a
This
joy.
brought me joy.
Yes,
Yes,
that's right. Onwards together.
indeed. Thank
Bye.
you.